Not be afraid of hip surgery. Hip surgery, total hip replacements, partial hip replacements, they're all very common procedures that are performed every year, millions of times a year. A hip replacement is simply removing the acetabulum and the top part of the femur, the head of the femur bone. Now, there also are partial hip replacements where they just usually replace only the femur, the head of the femur right here, and they leave this acetabulum intact. This is usually completed when that hip becomes very painful, becomes very arthritic, and it just becomes so bad with wear and tear that there's no way that it can be rehabbed by physical therapy. Either way, this acetabulum and this head of the femur is normally replaced with artificial joints made of metal, different plastics. But the main thing to know is that you can recover well. The recovery from a total hip replacement is amazing. As long as you're willing to put in the hard work and you're able to get some rehabilitation from a great physical therapist. So just know, do not be afraid of that. You might use a walker when you're finished, just to take the weight off of this side of the hip. So if you've had a right hip replacement, you might need a walker just so when you take a step, you're not putting as much weight on that right hip. You can push down with your arms and use it to help. It'll become more comfortable. As you go, you'll realize you don't even need it anymore, and you'll be able to take equal steps, placing that heel down with every step. So what happens after your hip surgery? Well, you'll definitely need to stay in a hospital about 1 or 3 days after surgery. And after that, you'll get to go to an inpatient rehab where you get to stay overnight. Or if you have someone that can help you, you'll get to go home. And just know you definitely will need someone that's there to be able to help you for a few days, if not even a little longer, like a few weeks. When you first get up, rest assured physical therapy will be there immediately. As soon as the anesthesia wears off, we're going to be there to get you up, teach you how to walk with your walker, teach you how to put on your socks or your shoes, determine how you're going to be getting in and out of your car to go home from the hospital. We'll be there to teach you how to shower and the best way to bathe. We'll probably also ask you a little bit about your home, because we're going to need to see if you're going to need maybe a grab bar, or after having a hip replacement, you're going to want a raised toilet seat so you're not sitting so low on the toilet each time when you go home. Also, we'll make sure that your walker is going to fit through all your doorways, or show you how to turn it sideways to get through some narrow doorways like your bathrooms possibly. We'll teach you the best shoes to possibly wear where they'll be easy to get on and off also. So just rest assured we'll do all of that for you. It's a very easy process. Most of you will be able to get back to your light duties in about 3, maybe 4 weeks. You'll get back to doing what you normally do, getting dressed by yourself, doing small things around the house. Now, once surgery is over, it's very important to make sure that you're continuing to walk. You don't want to get any blood clots, and oftentimes we'll give you some compression stockings to wear that make sure that although you're not moving as much as you moved before the surgery, that you're not going to be sitting for long periods of time. We'll also want to make sure that you're keeping an eye on that incision and making sure everything looks very healthy. Now, in about 3 months, let's see, you'll be ready to resume all your activities, possibly even all your low impact sports that you're playing previously. It's so important to continue walking though, and to stay with a great physical therapist. We want to make sure that your balance is good, your coordination is great, your flexibility is good, and that mobility in that joint, that motion is outstanding, as well as your balance. You don't want to have any falls or accidents. But a total hip replacement is something that's very common. Your prognosis is great. Do not be afraid. Your recovery is going to be absolutely amazing. Just remember, put in the hard work and make sure you find a great physical therapist.